my name's Kristin. I'm a student physical therapist here, and today I'm going to be talking about low back pain. So, for low back pain, it is a very common diagnosis. About 80% of people will experience low back pain at some point in their life. So, you're not alone if you have back pain. And a lot of times when people have some findings on imaging, like MRIs or x-rays, most of the time their pain isn't coming from those findings. So that is very common. But the best way to manage your low back pain is by slowly introducing yourself to gentle activity. So if you've come in for therapy here, you'll see that we always start with little movements, not moving a lot, and then slowly progress our way to bigger movements there. So with doing this, we want to focus on strengthening our core and our back, as well as our hips, to help support our spine and low back. So that's like if something's going on at your spine level, that's the best way to manage that. And if it's more of a muscular issue, movement is the best way to promote circulation for your body, and our blood carries nutrients and oxygen to our muscles, which is what is needed to heal the tissue. So that is why movement is so important. And a lot of times we all think that when we have pain we should rest, which is a normal response. That's how we all think, but really the research shows that movement is actually better than resting. So, our mind also has a big effect on the way we think about our pain. So, every time we have pain, or even if someone touches you, the signal is sent to our brain to process that information. So, a lot of times if we think about the pain a lot, our brain will focus on it more than it will focus on other things. So that's why it is important to try to find ways to change our thoughts about our pain in order to get our brain away from that, so that we're able to start moving and making it feel better. So by doing this, we can take small steps towards recovery to strengthen our muscles and get moving to help overcome that. So I'm going to go through a couple things that you can do to help with this. So one is relaxation techniques. So working on deep breathing before you do exercises, or when you feel like really intense pain, you can do deep breathing to help kind of take control of your own body and help calm it down, to make your brain relax a little bit more, to help with the thoughts of your pain. Another thing you can do is find something that motivates you to work towards your goals. So let's say you wanted to go walk with your grandkids. So having that thought there to motivate you to start building towards activity tolerance will help your brain assess the pain in a different way, so that it's not too focused on it, help you reach your goals. Also, it's better to make tiny goals instead of huge goals. Like let's say if you have a walking goal where you want to walk a mile, set the goal as little tiny increments. So let's say you want to walk for 30 seconds with no pain, and you're gonna do that until that starts to get easy and you start to have no pain. And then let's say you go up to a minute of walking, and keep doing that until you reach your goal. And every time that you move a step forward, you can celebrate, because that is the best way to keep your mind positive and avoid all those negative pain signals from being so focused in your brain. Okay? And then lastly, all of us here, all the therapists, we're here to support you, and we want you to reach your goals. So anything we do in therapy is safe to do at home. Any of the exercises, we would never tell you to do an exercise that we think would make your pain worse. So we are here to support you along your pain journey. Yeah. Good stuff.